Yes, so I'm Tom Reardon, I'm the Chief Executive of Leeds City Council. For these purposes, I'm the chair of a new group, the Leeds Health and Care Partnership Executive Group, which is basically the group of chief execs and accountable officers of the key organisations in Leeds who are going to try and make the changes that we need in the health and care system in the city. Well, we realised that sitting in our roles, at the top of the organisations, in inverted commas, the real people who are going to change this are the people on the front line and the people who are providing the care and the services to people on the ground. So we realise that often the corporate communications that come out are a bit dry, they're a bit technical, they're aimed at different organisations, and we're trying to break into that and get a message across to people that actually the front line is the key to getting this changed. It's probably more about culture and about how we work together than about structures and processes. And that's really what we're going to try and do over the next few months, is to break into that and to make people's lives easier, their jobs easier, instead of making them more difficult, which we can do at the top of the organisations from time to time. Yeah, I mean, we've got the demographic changes in the city, so the ageing population everybody has heard about. There's also an influx of more people with special educational needs, more people living longer with disabilities, which is fantastic, but that brings more challenges for people in the system to provide the care that's needed. It's all about getting personalised individual care for people and breaking down those organisational boundaries so that people feel that they're having one service in the city rather than 20 different services. And that's the big challenge for us, because that's not easy as different organisations. We also have a saying of the Leeds pound. So rather than us all operating in our different ways to protect our own organisations, how do we operate in a way that gets maximum efficiency and maximum effectiveness for the way that people deliver services in the city? Because we've got a big financial challenge, there's a gap, and we've got to fill that gap. Definitely, we're the third biggest city in the country. We've got major health assets in the city. We've got the biggest teaching hospital in Europe. We've got private sector pioneers like TPP and EMIS. We've got a great group of organisations in the city. The universities are world leaders in surgical processes and tissue regeneration, things like that. So we've got fantastic assets. We've got a lot to show already for the partnership working we're doing. We're the one place in the country that's cracked the single patient care record. We managed to go from worst to best virtually in the country on children's safeguarding. We hit the target for 95% A&E, unlike other places. So we have things that work. We've got long-term stuff on cardiovascular disease, where we're reducing health inequalities. These are really major steps forward. But it's not enough. We've got to do more, we've got to get better, and we've got to get much better at the integration of services on the ground. We've got to get closer to GPs and primary care. We've got to have fewer people spending time in hospital and seeing A&E as the route to get treated. We've got to make that people's homes and the community a much better place for people to get better health outcomes. So lots of big challenges. Balancing the finances is probably the biggest one, but we think we can do it, and this partnership is how we're going to try and do that. The main thing I want to say is thank you on behalf of all of us. We realise how people are working harder. We realise that there's not been significant pay rises in the system for several years for lots of people. We understand how much people care about the NHS, about social care, and what a massive difference they're making on the ground. So a big thank you to people. But also, we also need them to work smarter, to work better together, to respect people across the different organisations more than ever, and to help us make the difference that we need. And if people have ideas about how we can work better and what we need to do in the partnership group to get those changes to happen, we're all ears at the moment. We want to listen to people, and we'll be engaging with them over the next few months to that end.